The supplies you'll need to complete this skill include a toothbrush, toothpaste, an emesis basin, a towel, a cup of water, and gloves. Make sure to check these 15 benchmarks as you go to complete this skill. A step that is highlighted in red and bold type is called a critical element step. Critical element steps are important steps that must be performed correctly in order for you to pass the skill. If you leave out a critical element step or do not perform it correctly, you will not pass the skill. Good luck!
In this video, we're going to be looking at skill 20, cleans a patient's teeth. So we're going to be brushing teeth in this video. And at this state, you will have to do this on a live person, so you want to practice this often. I'm going to gather my supplies. I have a towel for around my patient's neck and my gloves. I also need a toothbrush, a toothpaste, an emesis basin, and a cup of water for our patient to be able to swish and rinse all the water out of their mouth or the toothpaste out of their mouth at the end of the skill. The important things to remember about mouth care is we need to sit our patient up to the side of the bed. We can't prove 75 to 90 degrees, so raising the head of their bed would not suffice for this skill. Also, you want to make sure that you only use a pea-sized dollop of toothpaste. If we coat the entire toothbrush with toothpaste and a piece breaks off, our patient can aspirate that. So we start with a pea-sized dollop, and if you need to add more, you can, but start there. So I have my supplies. I'm knocking. Good morning, Miss Megan. My name is Teddy. I'm your student nurse aide, and I'm here to brush your teeth for you today, if that's okay. I'm going to make sure that you're private. I'm going to make sure that your bed is locked. We've got you in the lowest position. You're lying flat on your back to start. I'm going to tuck your call bell underneath your pillow by your left shoulder. I'm going to go ahead and wash my hands, and then I'm going to glove up. So if a sink is not readily available to you for this skill, you can pour the water over the toothbrush. Just don't dip the toothbrush into the cup of water. We're going to get you uncovered here. And I'm going to assist her to sit always. On the count of 3, go ahead and sit up and swing your legs off the side of the bed. 1, 2, and 3. All right, feet are flat on the floor for me. And I'm going to bring my table with me so that we're not walking back and forth. All right, before we start, Miss Megan, I'm going to get a towel around your neck. We don't want to mess up your lovely clothes. And then I'm going to wet my toothbrush. Now, the important thing is that we maintain clean technique while we're doing this skill. That means once I've wet the toothbrush and applied toothpaste, I don't want to set it down on any surface. I'm going to hold it in my hand. So I'm going to wet my toothbrush, and I will get a pea-sized dollop of toothpaste on the toothbrush. Recap your toothpaste before you set it down. We don't want bacteria in the toothpaste. Okay, Miss Megan, I'm going to start brushing your teeth. We're going to start on the bottom, cleaning all of your surfaces, and then we'll work to the top, okay? So I'm going to hold this here. If you need to spit at any point, you just let me know. Go ahead. I'm going to clean her teeth on the bottom. I'm cleaning her teeth, the gums and teeth on the front, in the side, and on the opposite side. Coming in, we're getting the tops of her teeth, her chewing or biting surfaces all the way around, and then I'll get her teeth in the back all the way around. Her teeth on the top all the way around, the chewing or biting surfaces all the way around, and then I'm gonna get behind her teeth all the way around. If you could stick your tongue out for me, Miss Megan, I'm gonna brush her tongue. You can go ahead and spit into that basin for me. Perfect. I'm gonna give you, you can hold this. I'm going to give you a cup of water, rinse and spit. Do you need more? You feel good? Yeah, perfect. All right. Now I'm going to take this. Don't leave your patient with anything left on their mouth or any strings of toothpaste. I'm going to clean her up just like that. And then I'm going to put that to the dirty side. I can set my basin down, and Miss Megan, I'm going to assist you back into bed. So go ahead and get back up. Perfect. I'm going to cover you back up. We always want to get our patient safe before we worry about dirty supplies. Now I will go and get rid of my dirty supplies. This will go to the laundry. This goes to the trash, and I will empty, rinse, and dry my basin and rinse my toothbrush. So this goes to dirty laundry. This goes to trash, and I will be back. Miss Megan, we're all set. I'm going to make sure you're safe before I leave you alone. Feeling okay? Perfect. Your bed is locked. You're in the lowest position. You're lying flat on your back. Would you like your privacy reopened? Perfect. And I'm going to make sure that you have your call bell. You call us if you need anything. And I will say, wash my hands and skill complete.